Hello, everyone. Welcome to September's Roundup call. I'm Ashley Jones, Developer Relations Engineer based in the US, and I'm going to be your host today while we go through 3 good presentations, including 2 demos for the next presenter.
Yeah,
hi everyone. Can you hear me?
Sounding good.
Okay. Thank you very much. I'm Maxime Goe. I'm working with the OpenIMIS community. Here in the call we have Sunil Parajouli, which is from Nepal, and George Atombom, which is from Cameroon. I'm based in Yaoundé, in Cameroon, for years, and we are working on the with the OpenIMIS community to work on a sandbox setup project, which is basically a project to demonstrate interoperability's capability for OpenIMIS. And we had the opportunity to discuss and to see a working collaboration with CHT to build a workflow between OpenIMIS and CHT. So first I will maybe explain very quickly what is OpenIMIS if you don't know very well. And I will continue with a demo to explain exactly what we want to achieve. So maybe next slide, please. So OpenIMIS basically is a DPG, a digital public good for universal health coverage for the UHC implementation and universal social protection. We are working basically on different insurance schemes and in different parts of the world, especially for now in Asia and Africa, to provide a tool to manage health financing and social protection programs. Next slide. Yeah, that's an open source software. Obviously, we are managing 17 million people and growing, obviously. One of the most is Tanzania, because that's where we started from. And Nepal, of course, which is the second more important implementation. And Cameroon, of course, you have the whole list here. You can see that there is mainly countries from Africa and Asia, and one exception, which is Moldova, for a few months now. They are already deploying the solution. They already deployed it, and that helped them to manage health and social programs with OpenIMIS to save information based on the UHC, basically. Next slide. So obviously that's free of charge. That's an open source software. We are member of the DPGA, the Digital Public Good Alliance, and we have different partners we are working with, mainly the ILO, the International Labour Organization, the World Bank, the World Food Programme, and the International Social Security Association. Since 2023, we worked especially with the World Bank digital solution Core MIS, and we integrated the Core MIS solution in OpenIMIS. So now we have, let's say, a software including both solutions, Core MIS and OpenIMIS at the same time. So yeah, next slide, please. I will try to explain what we achieved with this interoperability. This slide is maybe quite complex, but that's very simple. The use case is very simple. We choose at the beginning of the project to work on a very simple workflow, just to share feedback between OpenIMIS and CHT. So basically, the community health workers who worked already with CHT can use the CHT system to give feedback about claim, about care provided by the the health facilities, and basically the health facility is registering the claim, the care provided to the beneficiary, and this same claim is sent to CHT. CHT will create the task, and the community health worker on the field will have the capability to check with the beneficiary if he has received the different care, the different question, let's say relevant, to be sure that the care was correctly provided. So if it's a free care, we have to check it. Is the care on good? It was good care, or anyway, lots of questions defined by the insurance scheme. And the community health worker will just register the different answers from the beneficiary itself. And this feedback will be sent back to OpenIMIS in order for the insurance scheme to track and follow the different feedback from the field, the real beneficiary of the system. So that's kind of a complex slide, but to be simple, that's the process. In order to do that in between OpenIMIS and CHT, we deploy interoperability layer. We deployed, we use the FHIR standard we follow the standards of communication between different health systems. The one we choose was FHIR, and that's what explained this interoperability workflow. Maybe the next slide is probably simpler. So next slide, please. So like I explained, the health facility on the left register the care provided by the health facility and create a claim in OpenIMIS. And this same claim is sent automatically to CHT, and CHT proceed with the task creation and the feedback form that the community health worker has to fill. Then when the form is filled by the community health worker, then it's been sent back to OpenIMIS to share information. So that's almost what we achieved. And I wanted to mention that's a very simple use case, a simple one, but let's say an important one, because that was based on feedback from Nepal, where they have this exact kind of problem to solve. And for sure in Cameroon, because we deploy OpenIMIS for the UHC management in Cameroon as well. We have the same kind of use case on the field that the focus is to reduce the fraud in the UHC context for the insurance, and to be sure that the care provided have good quality, basically. So maybe we can continue with the demo on my computer. So I will share the screen. Okay, you should see my screen. So I will not go into details on OpenIMIS interface. That's not really interesting for you, but basically the health facility will connect to OpenIMIS, and he will basically claim. And obviously, in order to claim, he will have to choose the family related to this claim. So this interface can be quite maybe complex for you because you are not used to that, but that's used in multiple health facilities around the world. So here you have the interface for claiming. Basically, the claim administrator, the responsible of the claim in the health facility, will just create the claim. He will enter the insurance number, so the insurer, the beneficiary of the care, is able to define a diagnosis. He can define a claim number. Again, those claim administrators are used to this kind of interface already. And he can define the care provided to the beneficiary. And then, if it's okay for him, he will just save the claim. When he saves the claim, when I will click on this button, basically OpenIMIS will save the claim on this side. And at the same time, we'll send it, let's say it's simple, we'll send it to CHT. And CHT will be able to, the community health worker working on CHT side will be able to receive the task that he has to do. And this task will just be to be sure that this injury has this care. And we will have to fill a very simple form, but that can be interesting to have a feedback on that on the health facility level or on the health, on the insurance scheme level. So let's save it. So here you can see that I'm on a server which is OpenIMIS.org, but I will now get back to the server, the test server provided by the medic team, and I will synchronize it. So when I'm synchronize it, now I have a new element in the report. I'm not an expert on CHT, obviously, but I have an element on the report with the new beneficiary defined here. So if I'm going in a task, like probably a community health worker, I can see that I have a new task here created for the same beneficiary created on CHT side. And on clicking here, I will have the formula, the form to fill. You can find, again, the claim code that I fill on OpenIMIS site, just to be sure that we are talking about the same care provided. And here, for the purpose of the proof of concept, we created a very simple form in order for the community health worker to fill and to answer a few questions with the insurer, with the beneficiary. So here you can see, was the care service indicated in the claim actually rendered? So you can fill and yes and no. And at the end of the day, you can give a note, a scale for the overall service received. And then the community health worker will just submit his form. The result after clicking on this button is that on OpenIMIS site, we will have the feedback. We will receive the feedback again for the insurance scheme to follow it, and the review team to be sure that the medical advisor to be sure that everything is going fine, and that the community health worker gave a feedback on that. So I'm clicking on submit, and then the report is submit. The task is finished on CHT side. So now I will get back to OpenIMIS again, and we'll try to find the result of it. So here you can see the different claims. So the claim, the care provided by the different insurer. We now go to review, because there is a review process of those claimings. And here we can find the different feedback status, and those status means that those feedback has been done on CHT side. And if we click on it, whatever, I don't really remember, you can find here the same feedback with the date of feedback. You can find the care rendered, so that's the yes, no question that they just answered just before. And you can see the result for the different claims created, because one after another, the community health worker will fill those feedback forms on CHT side, and then we will have the result on OpenIMIS side. So again, that's a very simple workflow that we design, but the purpose of this was to firstly explain that with those interoperability scheme, it's possible to improve the system on OpenIMIS side and on CHT side at the same time. And to strengthen the insurance process, the healthcare provided by the different organizations, in order to check, to track, to limit the fraud, and to have feedback directly on the different tools for the care provided in this UHC context. So I think that's almost it. Obviously, there is a lot of next step we can think about, because there is a lot of interoperability workflow possible. But the purpose was to demo something very simple, and to open the door to more important and more maybe developed interoperability workflow. So thank you. That's it for me.
Wonderful. Thanks so much, Maxime. Really great to see not only that these integrations exist, but to actually look through the live demonstration to get a feel for the data workflow. Before we move on to the next topic, any questions for Maxime and the OpenIMIS team? All right, I don't see anything in chat. No one's coming off mute. I see some.
Yeah, Jones.
Yeah, Anthony.
Yeah, just to appreciate Maxime, Sunil, and the OpenIMIS community for the wonderful work they have worked on with the CHT community. One of the questions I have, we also have a partner in Zanzibar, D3. They've also been using OpenIMIS, and they might be interested to adopt such a use case. So Maxime, are you planning to share these with the community, both communities, so that in case any partner is interested to adopt the workflows or be able to learn from it and customize to fit their own settings, they can be able to do that?
Yeah, thank you for the question. Yeah. Basically, like I mentioned, that's an open source project, and all improvement that we did for this context is open source for the whole community. So I know that there is a Zanzibar implementation of OpenIMIS, and obviously they will be able to implement it. To implement this kind of interoperability workflow. I have to underline that most of the work was done on CHT side. On OpenIMIS side, the Fire API was already there, so everything was almost already there, and the work was mainly on your side. And I hope that on your side as well, you will open source it. But on our side, it's not a problem, and that's already available. Thank you.
Great, thanks, Anthony. I know we also have documentation on how the interoperability works at a generic level with the CHT. And I think any extra details that we gather from this integration, we can extend the documentation to make sure that's included. All right, any other questions before we move on? All right, then we'd like to do a community introduction. The Edify team has been in touch with Medic about helping out with the CHT, and I wanted to give them a chance to introduce themselves and what they're up to. So I'll hand it over to Edify.
Hello, everyone. Yeah, my name is Javier Perez. I'm a co-founder and partner at Edify. I have been in the software development industry for the past 25 years. I have been playing different roles, from junior developer to software architect, engineering manager. Right now doing a little bit more of management, but still involved in the technology part. As Ashley said, Edify started talking with Medic like a few weeks ago. Edify is a Costa Rican-based company. I will say it's a small, medium size. We are around 90 to 100 team members. We work mostly with US-based companies, mainly in the education field, ed tech. We do all kind of developments. It could be mobile, it could be web, it could be backend. Even like command line things. Like we do like customized software for our customers. But we also time to time try to get involved with non-profit organizations to help them with their mission and vision. We have right now working with a couple of them, and we recently we got a person in our team, Tatiana. She used to help and work with Medic, and I was talking to her. She was explaining what you guys do, all the good impact that you guys have. It was like a company party, and we decided to approach you guys and start talking to see if there is something we can do. Things went pretty well. Right now we have around 5 to 7 people working in different tickets. Right now we are knowing more about what you guys do, how you guys work. We hope this is going to be a really long-term relationship, and hopefully soon we're going to be helping you guys with your initiative as well, having discussions about how to improve the entire architecture, infrastructure, and also get involved in how things work, not only the technical part, but also the processes. We have team members that also do project management, just in the case you guys need some help organizing things. We have developers, we have DevOps team members, and QA folks. We are really excited to be here. The team is really excited. The entire company knows that we are in this. Next year, we are planning probably to bring interns to be dedicated full-time to medic initiatives with the supervision of our senior talent, of course. But yeah, hopefully, again, this is going to be a really long-term relationship with you guys. We are really happy, really excited. I think we are pretty aligned in values in our mission and vision. So that's what we're looking for. We need to give back. We want to give back something. If you guys want to know more about Edify, please go to the website. Feel free to ping me over the email. If you have any questions right now, let me know. I can talk hours about Edify, but we don't have hours. So if you want to know more, just let me know. If you want to come to Costa Rica and have a face-to-face meeting, you're also welcome. We are always happy to receive people here. And that's pretty much, that's like a quick summary. I don't know if you guys would like to know more. I'd give you the chance to ask questions if you guys have any.
Thanks so much, Javier. Anyone have any questions about what Edify is up to? I will say that it's been really great to see the Edify team start to integrate across GitHub and attend different calls. We do have a good first issue label on the GitHub tickets, which invite members to grab a ticket that's curated and ready to, be worked on. And Edify has been working through that queue, which is helpful, and also pushing back on Medic to make sure that queue is populated. Thanks to Anthony for making sure that's happening. Beyond that, there's also the help wanted label, which I think Edify is going to start diving into for more complex issues that might take a little bit longer than the good first issues. Javier, thank you so much. It's really been great to see your team really jump in to the community and to the tickets. I don't see any other questions. Yeah, anything else before we wrap it up here on the Edify topic, Javier?
No, just to say thank you. We are honored and really happy to be here. Thank you for giving us the opportunity to contribute with your community. Yeah.
Wonderful. All right, well, feel free to jump in with any last minute questions. We have 5 minutes left, but I'm gonna move us on till close us out if there's no other questions. So next slide, please. We have some upcoming calls that you're welcome to join. The community meetup is on the 23rd. The dev hour is on the 25th. Spilling over into next month, we have the dev demo hour. And then of course, we'll have October's Roundup call on the 9th. Feel free to jump into the forums if you have any questions. And as well, we'll be posting recordings and a summary of this call on the forums as well, in case you want to go back and review something or share it with your colleagues. All right, last chance. Okay, thanks everyone. Thanks to all our presenters. Really appreciate your time to share what's going on and stay in touch with the community. These calls really help facilitate the cross-group communication, and it's really important. So we're very appreciative. Thanks again, and have a good rest of your day, whatever time of the day it is for you. We'll see you next month.
Thank you all. See you. Bye-bye.